I'm Steve Lampkin and welcome to Sure in the Saddle. We are joined with Chuck Potter today from HoofCinch. Chuck has been part of the show since we've started probably about 10 years ago on RFD-TV and the Cowboy Channel. And we're going to discuss today about the lift. Tell us what you've done with the lift, because you've had commercials and we've had banners about the lift and we've talked about the lift in the past.
Sure.
But you've made some changes to it, and how does it help horses with navicular?
Sure. Well, first, when we first designed it, it was only meant to stay on for 30 days or less.
Okay.
And that on 1 foot. So most cases of navicular are usually on 1 foot. It's very rare you have both front feet involved.
Okay.
If you do, we have trouble keeping these on for a longer period of time that would be needed for other problems, such as your low heel, long toe, that kind of thing. So we developed these to create a pretty massive lift at the heel, but to be separate.
All right.
So we have
we were discussing this split toe theory.
Yeah, split toe theory. So that way the horse can actually load one side of the foot without affecting the other side immediately. Like if you have a shoe on, it's a rigid structure, so if he puts this one's coming down.
All right.
With this on, it's on each side of the foot and there's no toe piece. So we're protecting the heels but leaving the toe on the ground, so if they're not growing a heel, it protects the heel and wears the toe. Okay,
so for those of you at home, and we're doing these segments, these are educational segments, because Chuck and I have talked about this, and he's been part of the industry now for so long, but sometimes we get pushback, and these segments are actually for the horse owner themselves. We're educating the horse owner.
Right.
Where we're getting the pushback from is not the horse owner, but it's maybe another farrier who's does not understand this, has not seen this, is not aware of this, or a vet. So what would be, maybe like years ago before the lift was invented, how would you treat navicular?
Well, we had different types of shoes. We used to believe in rockering the toe and raising the heels.
All right.
That can still be helpful.
Right.
And we do for the
so
more mild
it's similar.
cases.
You guys are going down the same highway. You're just in different lanes.
This is designed for your more severe cases.
Okay.
And that's what I did the lift for.
So could you show everybody what they look like?
Yeah. These actually have the nails poked through them right now.
Okay.
Yeah. So each one of these goes on half the foot.
All right. So right here.
Before, we would just glue them and put some screws through these holes.
Okay.
And so it would sit on the foot like this.
So the little tack screw that you would use like on the HoofCinch.
Same size.
Okay.
Yeah. So we would, go ahead and put those screws in just to hold it in place, and then.
And you just hammer the little flange down so it makes contact.
Yeah.
Okay.
And now you don't have to do that.
All right.
With this new, because I took out the 2 side pieces.
Okay.
And I put 2 nail holes in here.
All right.
So these will not come off now. So your horse can move around more.
So you could put them in a paddock or something like that.
Exactly. We used to have to keep them in a more contained area.
Okay.
For the time period, because you're just a glue, and a lot of times because they're
just going to break off.
They pop off.
Right.
And that's where we would get most of our, because I got a vet from Florida. He had talked to me. He said, yeah. So I put them on, but as soon as we got done, he walked away and they popped off.
Okay.
And a lot of it's a gluing technique, because you have to talk to the representatives of the glue companies and take their training on their glue.
Okay.
Because it's very, very difficult to glue things on if you've not been trained on it.
Right.
Because this glue's not magic.
Okay.
I mean, it's got to glue to a hoof. If it's over wet or anything, pops right off.
It's going to fall right off. Okay. So this is different than the shoe because of that open toe. Talk a little bit about this open toe theory.
Sure. It's kind of a newer theory for navicular or horses who are having some kind of hoof problem, where we can get something on each side of the foot but allow each heel to move independently.
Okay.
And that was the purpose of this design, was to allow the heels to move independently. So if they're more sore, when we talk about navicular syndrome, usually it's not this little bone that's affected. This is the navicular bone.
Okay.
Okay. And this is not normally, it's very rare. I've very rarely ever seen it affected in this.
Okay.
Okay. It's usually the soft tissue in the back of the foot.
Okay.
That's why a lot of times if they do a nerve block and the horse walks off, we know the pain's in the back of the foot. We call it navicular syndrome.
Okay.
Unless we can figure out exactly which one of the 17 ligaments it might be, or other part of the foot. So what these things do is allow the foot just to move independently.
Okay. Yeah. So thank you. Hopefully you guys at home, this was some great information that you can put to use, share with your vet, share with your farrier, and this is going to help the horse that you have at home.